Welcome back to Local 4 Live, everybody. A live look at the Campus Marshes tree in downtown Detroit. It's a place filled with holiday joy, but for many, the season can bring loneliness and depression. Add social media to the mix, and those picture-perfect holiday posts on Instagram and Facebook can make people feel left out and isolated. New research from AARP shows loneliness is on the rise among adults 45 and older, with men reporting higher rates than women. Now, it could have several causes: lack of real connection, financial struggles, or even health issues. If you're feeling this way, you should know that you are not alone. To talk more about this, we are joined by Dr. Matthew Goodman. He is a psychologist from the Birmingham Maple Clinic in Troy. Doc, thank you so much for coming in. I think that message of that you're not alone is probably the most important thing right out the gate, isn't it?
100%. A lot of us feel like we might be the only ones struggling with loneliness, and even just the recognition of the sense that there are other people experiencing this, what we might refer to as recognizing our common humanity, can actually help, at least temporarily, to help to ease those feelings of loneliness.
Right. It's probably, compounded again during the holidays, because every message we see, every Hallmark movie, every commercial is about the family coming together and sharing meals and dealing with Uncle Crazy Bob and all that. But some people, they don't have those loved ones, they don't have family, and that can feel very isolating.
It can be really challenging for people, and as you mentioned, the role of social media can really exacerbate those feelings of loneliness.
Right.
For some people, it can make them feel more connected, but if we're already feeling lonely, going on social media and noticing those images of other people and seeing the Hallmark movies can actually heighten those feelings, unfortunately.
Yeah. Okay, so how do we navigate that then? If I'm somebody who is really feeling this way, the loneliness, maybe depression, what are some good steps to go through?
There are 3 recommendations that I would give to someone. Number 1 is to reach out, number 2 is to get out, and number 3 is to go in, and I can explain each of these.
Please, yes.
So reaching out, of course, if you do have access to close friends, family, people in your network that you can reach out to, of course, that's always the first step.
Yep.
The second step would be just getting out. Sometimes we don't have those types of connections in our life that we can readily reach out to. So just getting out of the house can make such a big difference for people.
Just taking a walk outside?
Take a walk outside, go to the grocery store, go do something that you enjoy. Even just making eye contact with a stranger, your neighbor, someone at the grocery store for a couple seconds can make a difference for people.
Sure.
And then lastly, going in, there's some research suggesting that practices like mindfulness or self-compassion or even journaling can help to ease feelings of loneliness, or at least help to offset some of the stress that comes with the experience of loneliness.
Is there a stigma surrounding this? That, if I'm starting to feel lonely, some people might just say, I'm just lonely, I'm not depressed, I'm fine, and they don't want to admit to themselves that there might be an actual issue here?
There is a bit of a stigma, and especially as you mentioned, Nick, for men too, there is that stigma of loneliness around that. And feelings of loneliness can help lead to or exacerbate feelings of depression, and feelings of depression actually heighten feelings of loneliness. So the two can work together in sort of a vicious cycle, and it's super, super important just to take a small step to be able to reach out to someone and prevent kind of that downward spiral process that can happen.
I've heard of some people, especially men, who I think, at least my opinion, maybe have trouble making new friends or new connections, doing random things like joining a book club or going someplace where those connections are kind of instantly forced. Is that a good thing to do?
I think so. It does not hurt.
Okay.
And even if the connections are forced, it might feel a little bit awkward,
Sure.
Of course.
But only for a while.
Only for a little bit.
Yeah.
Eventually, hopefully, those turn into bonds that can be, more sustainable over the long term.
What should we be looking for, though, if this is a longer issue? Say it does go into depression. What kind of warning signs?
Warning signs would be that you're not feeling motivated to go out of the house to do things.
Okay.
You don't feel motivated even to get things done around the house. You're not enjoying spending time around people. Maybe you notice that you're more easily angry or annoyed or irritable around people. You're feeling down about yourself, having issues with sleep. If you're noticing those sorts of things, it could be a sign that there are some mental health challenges there, and it's really important at that point to try to reach out for professional support, or at least to someone that you know and trust.
Now, is there a window of time that you should be looking at? Let's say that you might feel agitated or you don't want to be around people, but it lasts a day or two versus a week or so? Like when is it an actual issue in your opinion?
That's a great question. It's totally normal for us to feel down, to feel agitated.
I'm having an off day.
I'm having an off day. If that's
I don't want to be around anybody today.
We've all been there. We've all experienced that. So if you're noticing something like that for longer than a week, I would say, clinically, we tend to look at about 2-week window as something that would be indicative of depression.
Okay.
So if it's happening for 2 weeks or longer and you're noticing those feelings consistently, it's probably time to try to make a connection and reach out to somebody for help.
Gotcha. Okay, so that was my last question for you about the reaching out aspect of it. Again, I think so many people are hesitant or afraid or embarrassed to reach out and seek help, especially from a professional like yourself. What do you say to them who are afraid of that or see that as a stigma and don't want to do that because they think it's a sign of weakness or failure?
What I tell people all the time is it doesn't hurt just to do a single session. You don't have to commit to anything, and you're allowed to kind of shop around for a therapist too.
Sure.
And
Do a little
interview
window
different
shopping,
people.
see if you like them.
Exactly. Some people are worried, like, I don't know if this is going to be a good fit for me, or I don't know if I'll like therapy. Give it a few sessions, maybe even try a couple different therapists. And if you are finding that it's helpful, or at least there's some hope there that this could be helpful, it's something you can stick with. If not, then maybe we need to think about some other options that can be helpful for you.
Yeah, that's the first time I've heard somebody say you can kind of shop around and find a therapist that fits you. That's a normal thing?
It's a normal thing, and it's really important to find someone who is a good match. And again, the research shows that the fit, the therapeutic alliance between the therapist and the patient is one of the best predictors of the success of therapy. The better the fit and the better you feel aligned with your therapist and that you are on the same page and that you're being supported, the more likely you are to get something out of it.
Gotcha. Okay, Dr. Goodman, thank you so much for coming in.
Thank you for having me.
Happy holidays.